COVID cases climb. I'm Adrienne Pedersen. Today on Upfront, health officials have new somber warnings. One is to stay home this weekend. Next, I'll ask one of Milwaukee's top doctors if the virus is out of control. Then, Milwaukee looks at a face mask mandate. How will city officials get people to go along with it? Plus,
it's a gorgeous, beautiful, iconic structure.
How the new owners of Yerkes Observatory are thinking big and planning a comeback.
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
Thank you for joining us. The state is asking people to stay home this 4th of July weekend. Coronavirus is spreading in a majority of states, and some federal health officials worry we can't contain it. 38 states are showing a rise in COVID-19 cases. A top Centers for Disease Control official said last week that the virus has spread too far, too fast to get it under control. Some of Wisconsin's numbers are going up too, though not as fast as some other states. Local officials are warning about more people in their 20s getting coronavirus. In Milwaukee, the COVID situation is at least stable enough to allow the city to begin its phase 4 of reopening, allowing bars and restaurants to go to 50% capacity. But Madison, well, they're tightening up, once again limiting the size of gatherings and bar and restaurant capacity. Milwaukee might even require face masks in public, and we'll talk more about that coming up later in this show. But first, we're getting an update on the coronavirus crisis today from Dr. John Raymond, President and CEO of the Medical College of Wisconsin. So, Doctor, we always appreciate you being with us. I know that we're seeing this surge of cases in 20-somethings. What do you attribute that to?
Yeah, thank you, Adrienne. Really good question. I think it is correct that the average age of newly diagnosed COVID-19 cases has been dropping dramatically over the last few weeks. And I think the rise in cases in younger individuals is likely due to a number of factors. First of all, younger people may have a different way of looking at life and thinking about risk, and they tend to be more socially active and interactive and maybe less likely to adhere to distancing and face lines, especially around the holidays. And they're more likely to congregate in bars and at house parties, which are settings in which COVID-19 may spread more easily. And also, younger people tend to be more likely to be frontline essential workers who interact with the public. But in terms of symptoms, younger people can have the same symptoms of COVID-19 as older people, but for many, those symptoms simply aren't as severe. There is a particular risk for young people who are obese. However, it's important to note young people can become sick enough from COVID-19 to require hospitalization or intensive care, and in fact, they can even die from COVID-19.
I was looking at the Department of Health website, and it says that so far 8 people in their 20s have died from coronavirus in Wisconsin. That's not a high number when you compare it to the other categories, but that's still 8 people have died. So how serious do young people need to be taking this?
Yeah, I think young people should take it very seriously. And again, what we know works are relatively simple things. Wash hands, watch your distance, and wear face coverings, the 3 W's. I know that face coverings or masks may be inconvenient and a little bit uncomfortable, but the evidence is overwhelming that they protect people around you and also to some degree the wearer. So what I would say to young people is, you're not immortal and you can die from this disease, so be careful. Maybe more importantly, you should wear the face coverings and practice physical distancing to protect your older coworkers, family members, and friends.
Well, we do know that health officials have closed indoor service in bars in Dane County. How much of a health threat do you think places like bars are right now?
Right. Well, this may be unpopular, but I think it's backed up by the facts. Bars are very difficult settings to prevent the spread of COVID-19. People generally aren't wearing face coverings, they're not practicing the physical distancing, and they're indoors. So those are 3 areas in which there's a higher likelihood of spread of COVID-19. So I think that's a particular problem. So if we were going to focus on the areas where the spread is most likely to happen, I think bars would be near the top of the list. And we've noticed over the last few weeks in Dane County, they went from having relatively low numbers of daily cases to alarmingly high numbers of daily cases. So there's clearly a surge in Dane County right now.
Dr. Fauci recently said, clearly we are not in total control of coronavirus right now, and that he would not be surprised if cases go up to 100,000 a day. What do you think? Is this out of control?
Well, I don't want to get into the guessing game about what numbers could be, but we're already over 40,000 cases a day in the United States, and we were under 20,000 just a few weeks ago. So if we double again, Dr. Fauci's numbers might be close. I believe we really shouldn't be overly pessimistic about this. It is true that our case counts are rising rapidly and out of proportion to the testing capacity, but the age demographic is going toward younger individuals who are less likely to be hospitalized or have severe symptoms of COVID-19. It's really not too late to assume individual responsibility and to double down on what's been proven to slow the spread of COVID-19. All of us should do our best to practice what I call the 3 W's. Wash hands, wear face coverings, and watch your distance. And my message to younger people is that those simple practices will protect you and perhaps more importantly, your older family members, coworkers, and friends.
We've been hearing a lot about COVID-19 spikes in other states like Florida, Arizona, Texas. How is Wisconsin stacking up right now?
Yeah, that's really a good question, Adrian. We're a few weeks, maybe a month behind those states. And I think it's important to recognize that those states, as well as Texas and Florida, were doing quite well about a month ago. The fact that they're surging now highlights the importance of continuing vigilance. And of our neighboring states, I think Iowa is the one that's done a consistently poor job of controlling COVID-19.
So should we be concerned about a resurgence here?
Yeah, I'd say that we should be concerned about a resurgence of COVID-19 cases in Wisconsin because it's already happening. It's happening, interestingly enough, outside of Milwaukee and outside of southeastern Wisconsin, although our case counts are growing here. You know, we had a fairly steady improvement in many of our COVID-19 indicators between June 2nd and June 18th, but some of those have taken an unfavorable turn over the last 2 weeks. Our case counts clearly are rising. The percentage of positive tests has increased without a significant increase in the reported tests. And the reproductive number, which is a measure of contagiousness, has been consistently over 1.0 for the last 2 weeks. You know, on the other hand, though, deaths are trending slowly downward. Hospitalizations and ICU admissions have actually dropped. In fact, there were only 79 patients in Wisconsin ICUs on June 30th, which was the lowest number reported since the Wisconsin Hospital Association began reporting in early April. But we all need to be cognizant that hospitalizations, ICU admissions, and deaths are lagging indicators, and that we might not see a surge of admissions for the next 2 to 4 weeks when infected individuals become sick or pass COVID-19 along to older or more susceptible individuals who could become ill.
And is there a link at all, are you seeing, between these cases in younger people and people who have been protesting?
Obviously, that's a difficult question to answer. What I would say is it's been hard for people to tease out the impact of holidays, relaxed social distancing, overturning of safer at home, and reopening of various parts of our economy. So I would say right now there's no good evidence that the protests resulted in a significant and meaningful surge that could be directly attributed to the protests. You know, it's important to note a lot of the protesters were wearing masks and it was outside. On the other hand, it was difficult for them to practice the 6-foot social distancing.
Dr. Raymond, thank you for your time and for the work that you're doing.
Thanks, Adrian. Always happy to be here.
Milwaukee might be the first big city in the state to require people to wear face masks in public. Next, we have a lot of questions about that, including how they'll enforce it. And later,
What would you say is the significance of this to astronomers? It's, in a nutshell, it is the birthplace of modern astrophysics in the United States.
we'll take you along to the Yerkes Observatory in Walworth County, where new owners are charting a new course and planning to reopen.